Hi guys, welcome to Canada with Sobia Drip. Today we are gonna discuss about healthcare in Canada. This is a request from our lot of viewers from our recent video. We'll be sharing a link to that.
Ontario health data shows the average wait time in ERs was 20 hours before the patient got a bed.
We can firmly say that they are short-staffed and there is a flood of patients. It is unprecedented, the crush inside our hospitals, and it really does feel like the healthcare system is dangling by a thread.
And data shows 9 in 10 people turning up to emergency waited up to 33 hours for an inpatient bed.
Today's topic, as you all know, is healthcare in Canada explained. We will literally scrutinize, I would say butcher the healthcare system, and we will give you all the positive and negatives of the healthcare system in Canada. So stay tuned.
Guys, when you're coming to Canada, it depends on what ground are you coming. Let's say if you're coming as a student, if you're coming as an immigrant, in a PR, and if you're coming on a work visa, all situations are different.
Now, when you land as a PR in Canada, in Ontario specifically, and some other provinces, your government healthcare will not start until 3 months. After 3 months of being a PR here, then your government healthcare will start from the province. Now, each province has a separate healthcare system, so you will have to find out yours. Now, what happens for the first 3 months? You will have to get your own private insurance, which is kind of expensive. There are many individual insurance companies who will provide you with that, or international companies. If you're coming from your home country, always try to find out what rate they are giving and what rate you are getting here. So then analyze whichever is the best in terms of coverage and everything. Get that. Now, if you're coming as a student, you will have to get private insurance for sure, and you can ask your student advisor if they have a list or of insurance companies to help you with, or you will have to shop around in Canada or otherwise in international. From your back home, you can find out which insurance companies are giving you the best rate. Okay, having said that, second scenario is when you are coming as an on work permit. Now, if you are coming on a work permit, you will definitely have something by your employer. Find out from your employers, but usually they will give you a time period that your job will be permanent after 3 months of a probation period. So usually you will not get anything during that probation, and after 3 months all your health and wellness benefits will start by your employer. It should. This is the normal circumstances. And for 3 months, initial 3 months, you will have to get some private insurance in that case. Again, now coming to the PR part. Now, if you are coming as a PR, if you're coming to Ontario like we did, we were not given any insurance, healthcare insurance, for the first 3 months. So we got private insurance for the first 3 months for the full family, and I don't remember the costs right now. You can and also it will be different. It's 4 years after that period, so it's 4 years from that time. So now obviously the costs have gone up, and the inflation rate has gone up, so everything is very pricey. So find out, shop around, and see where you're getting the most out of your bucks.
So now we will let you know how to find a doctor. Yes, well, you can find a doctor at a hospital in emergency, and that will take a long time. We'll explain you how it works. Or finding a family doctor. Now, a family doctor, if you may be coming from a different country, you can just walk into a hospital or a clinic and get a service from the doctor. But in Canada, there are a couple type of doctors and clinics. One is a walk-in clinic. So you may walk in, and if they have availability, they can see you. You might see something like we're taking new patients, or we're not taking new patients. How to find a family doctor? You have to look around. What we did, we moved to a new city, and the first time when we were in Mississauga, we were lucky enough to find a family doctor just across the street. But once we moved to a different city, we were not able to find a new family doctor because all of them were fully packed. They were not taking new patients. So since then we have been struggling. It's been 3 months till now. We have approached everyone through Google, through family doctor. We called them, no one was taking. We requested them to call us if they start taking new patients, and then we moved to government organization. क्या है?
Healthcare Connect.
It's called Healthcare Connect, and we requested them, and they had our data, and because we cannot approach every doctor, so they have all the data of all the doctors in that region. So it's been 3 months and we still don't have a family doctor. And we had a friend, and they got a family doctor, and in 6 months, after 6 months they were able to get a family doctor. So it's simple. If you don't have a family doctor and you're not lucky enough to have a clinic nearby who is taking walk-in, you may have to wait
Or go to the emergency. So now coming to the emergency department. Now, say for example, when you'll go to the emergency, obviously in evenings and on the weekends, you will not get your family doctor open. So you will, if you have a medical emergency, you will have to go to the emergency department in the hospitals. Now, the problem with Canada is there are very few hospitals here, and though they have very few staff. Healthcare staff is very, very less in Canada, and with the number of immigrants and the number of people here waiting to get the medical care is very high, and the healthcare staff is very, very less. Now, there are many reasons why this unproportionate thing has happened, because first of all, the influx of immigrants is very huge, and every year it keeps on increasing, and the healthcare staff who are already retiring, but the influx of new doctors, Canadian Medical Exam Board is not easy enough for international medical graduates to pass and get jobs, because obviously there are very few number of hospitals and clinics. So this unproportionate thing keeps on increasing, this gap keeps on increasing, and that is where comes the wait times in the emergency departments. If you are going there at night, you will definitely expect to spend around 6 to 8 hours when you will get to a doctor's examination room. So this is the wait times, and what people do here, they either go to Mexico or they go to US, pay out of their pockets and get themselves medical treatment. Now the problem is, when you are seen by a doctor in the emergency department, the doctor will see you, do the x-ray or whatever immediate thing they have to do, they will do it and give you a prescription for further diagnostic treatments, or they will send you home with a prescription. Now after this, there will be no follow-up from the emergency department, obviously, or if you need a specialist's appointment, they will tell you to see your family doctor, who will then refer you to a specialist. Yes, so they have the facility, but they keep it for very, 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 very critical patients. They will do, because of the less healthcare staff in the hospitals, less CT scan technicians, less X-ray technicians, even only, I would say, one probably in the department would be there if you're going in the emergency. So they will keep them free for very, very critical condition patients. If you have any provincial healthcare system, if you are covered by the government and you don't have a private insurance, obviously you will have to pay everything from your pockets. You will be literally every medicine, no medicine is covered in Canada except for the children. And for children also, the prescribed medicines are free from the government, but Tylenol, cold and cough medicines, all the over-the-counter medicines that you can get from the pharmacies without prescription, or you can go to a pharmacist and tell them that, this is the condition my child is having. Say for example, they have cold, cough, allergies, all those medicines will not be covered even for the children.
Yes, recently, we were not able to find these medicines, cold and cough, and the one we were able to find were costing around
$60. Okay, now comes the issue of availability of medicines. The medicines, because Obviously, the supply is not that much and the demand is more because of obviously the changing weather, the winter weathers, the harsh winters, and the allergies are very common in Canada. Because of all these reasons, people and children get very sick very often, literally. Like, there are months we have been without medicines, and even now if you go to a pharmacy to go to Shoppers Drug Mart, and you will not find any children's Tylenol or cold and cough or allergy medicines. And even the adults medicines are they are not there, the shelves are empty. Okay, let's talk about the dental now in Canada. And so now dental, as you all might be knowing, that dental is very, very expensive in Canada. So what happens that for if you have children, and if you are a PR here or on work visa, you might be covered by a private insurance, or if you are a PR, you will have the government insurance by the province, and your children will be covered. If you belong to a low income family, then your children might have the free dental care provided by the government. But once you cross that limit of low income, they have a set limit, they have an income bracket. Above that, you will have to pay the insurance for your kids and yourself out of your pockets. Now comes the employer coverage for dental for you and your kids. Now, if the any employer in Canada, they usually give a percentage, and they usually give a limited amount of dental coverage, either fully, or they will give 80% of that coverage, up to that coverage. Dental treatments, dental diagnosis, and dental visits are very expensive in Canada. Say, for example, one dental visit will cost you anywhere from 150 Canadian dollar up to $225. The dentist will just check you, and then he will give you some x-rays, or he will do the cleaning or scaling, or he will suggest you that you have to get some fillings done after the x-ray is done. So everything has its own cost, which is again expensive. Like, for example, dental cleaning costs you $100 average, and or if they tell you if there is a tooth extraction to be done, they cannot see it in the x-ray, they will ask you to go for a CBCT scan, which will cost you around $300 to $350. So I'm just giving you the idea of the prices, that dental is that much expensive. So even after the CBCT scan, the dentist will either say that you have to get the tooth extraction or a root canal or fillings to be done. Then those treatments are very costly in itself. So a dental extraction can cost you from $1,200 up till, it can go up till $2,000, $2,500, depending on the complexity of the tooth and what has to be done. So if your employer is giving you 1,000 Canadian dollar annual dental insurance, or 2,000, up to 2,000 is considered to be very, very good for the full year, and which is nothing. So I'm giving you the costs in terms of so that you can have an idea how dental process works here.
So if you're coming to Canada on a visit, on PR, on student visa, or on job visa, you must watch this video to understand your need for medical insurance benefits.